So my name is Philippa Jackson. I'm a consultant plastic surgeon and I'm based down in the southwest of England. So I decided to do plastic surgery slightly later in my medical career. I went to medical school, and when I graduated, I wasn't really sure what I wanted to do. There were so many areas of interest to me within medicine. So I chose to do quite broad-ranging subjects as a junior doctor, but one of those was plastic surgery. And as soon as I did it, I knew that I was hooked and there was nothing else that I wanted to do. I really enjoyed working with my hands. I loved working with the patients. And plastic surgery in particular is a specialty that's all about bringing people back to themselves, whether that's in terms of their function or their shape or their form. And it's so closely linked to the people that we are and the way that we interact with others and in society that it just seemed so special as an opportunity and such a rewarding thing to do that there was never any other option for me after that. So there are lots of things that I love about the work that I do. Probably the most rewarding is the difference that I make to people and the difference that I see in them from when I meet them before their surgery to when I meet them after their surgery. The way they walk into the room, the change in their clothes, the way they carry themselves. It's incredibly rewarding to see that and the difference that you've made. I also really love the work that I do. And the thing I really like about plastic surgery is that you can see the difference that you've made from the start of the operation to the end of the operation. So I can already tell what change I've made to that individual. But the best part about it is when they come back and you can see that it's lifted their confidence, it's achieved their goals. And we've done what we set out to do, both in terms of the technical aspects of the surgery, but also in terms of what they wanted to achieve and how they feel about themselves. So that is certainly the most rewarding part. So the thing that I value most about my patients is probably the thing that I think they value most about me, and that is honesty. I always try in consultations to be transparent, honest. I don't rush my consultations. I take time to listen to people so that I can really understand what they want to achieve, not only in terms of a look or a change in their physical appearance, but also in terms of the change to themselves. And I think the more honest patients are with me when we're having those conversations, the better able I am to tailor their surgery, but also to tailor their entire treatment. So I can then treat them completely as an individual rather than just treating a single body part. So I think that the honesty and the openness, the transparency about the short and the long-term results are the things that patients like about coming to see me. I'm also quite straightforward. I don't beat around the bush. We talk very openly about risks and complications and consequences of surgery. And I think that patients' feedback certainly seems to suggest that that's something that they like to hear, and we can then work together towards achieving their goals together.